So now we cordially invite Dr.Sarvpreet Singh to come to the podium and give your presentation. Thank you.
Respected dignitaries on the dais and off the dais, my presentation today is about the role of Ayurveda in psychiatric disorders. Well, basically, we all are psychiatric patients. Some are suffering from anger, some are from pride, and some are from ego. So what Ayurveda can offer in such scenario? So this is Ayurveda and psychiatric disorders. So basically, what are the stress-causing factors? Highly competitive work environment and increasing demands of family and friends, we all know, fast food, fast life culture, and overuse or misuse of electronic gadgets. So this is stress. The whole world is looking for the solutions of the inner conflicts afflicting mental health sector. We can't deny the role of modern equipments to make our lives simple, but we should not become slaves of advanced gadgets. Similarly, multitasking and meeting deadlines also causing mental strain. Ayurveda can surely provide solution for these psychiatric problems to the world. Now, Acharya Charka has discussed psychiatric problems under the heading of Unmad, which resembles modern-day classification of mental diseases such as anxiety, depression, obsession, personality disorders, and schizophrenia. The holistic approach of Ayurveda, how Ayurveda can help, it is comprising of Ayurvedic counseling, behavioral modification, mental nourishment, diet, herbs, classic medicines, and panchakarma. So, aim of my presentation is to prove the efficacy of holistic approach of Ayurveda in the maintenance of mental health and treatment of psychiatric disorders. Basically, in Ayurveda, treatment is of three types. First one is divine and occult practices, which is called Davyapashraya Chikitsa. Then physiological and pharmacological methods or rational therapy, that is Yukti Vyapashraya Chikitsa. And then psychological methods or therapy, which is called Sattva Vaje. So we all use all the three methods. Davyapashraya Chikitsa, it is also known as divine therapy or treatment by faith. These methods actually create confidence and remove the feelings and pessimistic tendencies. These methods include mantra, money, Aushadha, Mangal, Bali, Uphar, Niyam, Prayashchit, and Upavas, etc. Yukti Vyapashraya Chikitsa, it is also known as scientific treatment or treatment upon reasoning. We remove the pathogenesis and treat the cause by this method, and it deals with medicines and panchakarma. And Sattva Vaje, it is also known as treatment by self-control or psychotherapy, and it includes all the Mano-Nigraha methods such as control of senses, samriti, sadvritas, and retention of dharaniya vegas, that is to control the impulses of greed, grief, fear, and anger. It increases sattva guna and normalizes mental doshas, raja and tama. Well, symptoms of various modern mental health problems such as anxiety, depression, OCD, ADHD, bipolar, adjustment disorders, etc., can be classified according to Ayurveda into Vata, Pitta, and Kapha symptoms. Well, fear, anxiety, unrest, and rapid mood shifts, all these are classified under Vata symptoms. Then anger, aggression, suspicion, and unrealistic ambitions are Pitta symptoms. Then low drive, excessive sleep, depression, and attachment to the past, all these are Kapha symptoms. So Ayurveda advocates the use of herbs and classic medicine in mental ailments, but only after proper shodhana or panchakarma. Ashwagandha, Bala, Vatkulantak Rasa, etc. All these are some of the medicines which we can use in Vata problems. Then Shankhapushpi, licorice, red coral, and moti pishti, which is made up of pearls. All these, etc., can be used in Pitta problems. And then Pipali, Vacha, and Jyotishmati, these herbs can be used in Kapha problems. Well, we can nourish the mind. We can nourish it through the food. We can nourish it through the impressions and experiences, and through the three gunas, Sattva, Raja, and Tama. Well, the mind, like the body, has its digestive fire, that is Agni, and the digestive fire of the mind is intelligence, which we call Buddhi. So to ignite the mental Agni, we should do meditation, yogic breathing, and spiritual methods such as mantra recitation. It is required to ignite the Buddhi. While describing the principles of treatment, Acharya Charka prescribes the following methods: Jnana, Vijnana, Dhairya, Samriddhi, and Samadhi, which is self-realization, knowledge of Shastras, patience, recollection, and meditation. So basically, we use Shirodhara treatments, pranayama, etc., according to Ayurveda. Well, Ayurvedic psychotherapy, basically, it is a group of techniques to treat the psychological disorders, such as we use Dincharya, that is daily regimen, Ritucharya, seasonal regimen, and Achar Rasayan, that is moral code of conduct. There are three Manasik gunas in Ayurveda, like Sattva, Raja, and Tama. Sattva guna is light or intelligence, which is the state of complete balance. And Raja guna is ignorance, turbulence, motion, or action. And Tamo guna is inertia and darkness. Ayurveda advises a person to control the urges of greed, grief, fear, jealousy, and pride, etc., which are major reasons for many psychiatric problems, and advises adherence to sadvrita, that is good conduct, to increase sattva guna. Basically, we need to increase sattva guna. And ideal mental health is, it is clear that attainment of self-realization through proper understanding, it has been regarded in Ayurveda as a method of attainment of ideal mental health, and it can be used in removing the mental disorders by developing the true underlasting, and it can be achieved by company of Apta Purusha. So company of Apta Purusha, it will help. So the various treatments methods in Ayurveda, such as Mridu Shodhan, Gritpan, Ashwasan, etc., all these are necessary. And it is interesting to note that Ayurveda has given due considerations to the psychological, spiritual, philosophical, and pharmacological aspects of treatment methodology. So, conclusion. Hence, it is proved that by incorporating holistic approach of Ayurveda, we can answer the ill consequence of so many stresses and strains of life under which we are constantly put in this world. Thank you very much.